Dear students, ladies and gentlemen, we have with us Professor Bhavani Prasad Chakrabarty, the Medical Director of Health City Hospitals, Guwahati, and the former Principal of Guwahati Medical College and Hospital. We request Sir to kindly address our gathering, Sir.
When you have come here, join medical college, your intention is to become a doctor. You must realize from your heart that I want to be a doctor. If you are not thinking in that line, if you think that, okay, my parents have sent, let me complete, let's see, then I don't think you'll be able to become a good doctor. Remember, in this world, there are not many types of doctor, like very good, medium, low medium, or useless. There are only two types of doctors, good doctors or bad doctors. Good doctors could be in a very high institute, or he may be working in a small place, serving the rural areas or very down-to-earth people. And a great doctor, a bad doctor might be in a very big institute or in a medical college. So you have to decide that I want to be a good doctor. Now, when you want to be a good doctor, few things you have to have. First thing, that your conviction is that I am going to be a good doctor. Second is, you have to know about the subject. You'll be serving human beings, so you have to learn about your human body, its physiology, its anatomy in the first preliminary days. Then you have to learn about what normal will be taught now, abnormal, that is pathology, will be taught to you. Then with that you learn pharmacology, that is how you treat allopathic medicine. Some social things like preventive medicine, which is very, very important in a country like us, because in such a big country with so much of rural population and poor population, the best way of for good health of the nation is for prevention. So similarly, you have to learn some other subjects also. Now, if you don't have the knowledge, of the human body and its frailties, you cannot treat the patient. So you have to have a good foundation, plus you have to learn about the medical science subjects. And when you go to the patient, you must think that this person is not mere a patient, that he has given his body to touch, that he has allowed you to talk to him for your history, that while evaluating the process might be quite painful. Then you have to examine him, and for that you have to have a very good clinical training, and your knowledge must be perfect. You have to do it with great compassion, because when you talk to the patient, when you examine the patient, it might be quite painful for him. He may be repeating the same history of his pain again and again to different batches of patients. Second, while examining the patient, your movements, you're touching the patient, you're examining the patient might sometimes be painful or cause some discomfort to the patient. So you have to be extremely polite, and you must be extremely sensitive to the patient's wishes. If the patient says, I'm feeling pain, then you have to stop there. And after doing that, while examining the patient, after examination, history examination, you may have to differentiate. That will be taught by your teachers. And then you come to a diagnosis. Some medical students who have passed also, I have found that they don't have the knowledge, they do not learn, because they think that with the modern age, with the evolution of science, we can do a lot of tests, radiological, pathological tests, and you can come to a diagnosis. Sorry, that is wrong. You don't give them the idea. Don't think that my father has lots of money, after passing out, that I will have a clinic, I will set up all this, CT scan, MRI, good lab, and then I will diagnose these patients and make a. So, a simple example I give you is that a patient has come with headache. So, the doctor who knows, he will take a good history and proper, thorough differential diagnosis, and then only he will go to the. But a bad doctor will do what? He will order an MRI of the brain. And if he is lucky, fine. If he is not lucky, nothing will come out. He'll find that the report has given that there is no abnormality in the MRI. So he is in a soup. So he has done the highest investigation, but without any result. So I want that you should be having that knowledge that if a person has come with headache, it could be a tumor, at the same time it could be simple anxiety also. It could be simple cold also. So that's what I'm telling, that your knowledge setup, your knowledge should be proper. You should be knowing that this person, this age, these are the things, his medicines he are taking, whatever it is. So a thorough history, a thorough examination will be necessary. That most of the things you will learn at the bedside only. And when you go out of the gate of this hospital, you are all alone, remember. The day you finish your internship, you get your diploma, you get your university degree, you go out, whether in a car or a bus or wherever it is, you are all alone. You have to decide about the patient. So, you try to learn as much as possible while you are in the college and the university. I think that is the way how you learn medicine, thinking about that only. And remember, I am thankful myself to the lowest person in the medical college wards in Guwahati Medical College, who allowed me to take their history, who allowed me to touch their body again and again. And from learning that I can turn, because I know a very rich person will not allow me to examine him again and again. So please complete your education, both theoretical and practical, while you are in the medical college. You can ask stupid questions to your teachers now. But after passing out, when you practice, you cannot ask any stupid questions to anybody. So, knowledge is paramount, skill set is paramount, and you should have compassion. If you have compassion to the patient, if you think that patient is such, and if you can treat with compassion, what will happen to him if I do this? And if you don't have knowledge about medicines, side effects, so it's a huge, huge subject. It is not possible to learn it while you study MBBS course, but it's a learning process, and every day you have to learn. This is not a subject that you have passed and finished. No. Every day continuing medical education has to continue. You must renew, recharge yourself with your knowledge. So I don't want to bore you with much burden, but this is a burden. As you have come to become medical college, you have come here as our one or ex-teachers. So you are in a trap now. You are in a trap, but good trap. So while in the trap, you enjoy, at the same time study, you try to be a good doctor with compassion to the humanity. I wouldn't talk to you more. Thank you very much for inviting me, and my best wishes to the new entrance to the medical college. Thank you very much.